OCD is actually pretty clear and clean. There's some kind of consistent brain circuit involved, and brain abnormalities or brain dysfunctions, they're very consistent in OCD. There's always these basal ganglia, cortical circuits that are overactive, probably explaining why people can't stop what they're doing even though they know they should stop it. And that's a very consistent thing. The basal ganglia are basically a group of gray matter structures deep in the brain, and they talk to the brainstem, also where most of our neurotransmitters like serotonin and dopamine and norepinephrine are produced. And from there, they talk to the cortex. They talk to the motor cortex. And they talk to the cognitive part of the cortex, for example, the DLPFC, and they talk to the more emotional part of the cortex, the ventral part, for example, the orbital frontal cortex or the ventromedial prefrontal cortex. So it's basically a circuit going from motor to cognitive to emotional that orchestrates your daily actions based on input from these emotional, cognitive, and motor systems, right? And this is something you can even see in movement disorders. If you have a Parkinson's tremor and you're anxious, that can actually exacerbate your tremor. But the same is, of course, true for people with OCD who can have difficulties in movement. Some of our patients with OCD, they're completely stuck in deciding where to move or how to even talk. And that can look very much like these people with the sort of more motor cortex, basal ganglia problems. OCD is an interesting disease because you have an element of each of these three pillars. There's a motor aspect in OCD where it's difficult to move or not continue to repeat a certain movement. There's difficulties in flexibly thinking or shifting cognitive strategies. And of course, there's a big emotional part where you can't really move on because you're anxious or because it doesn't feel right. And those are basically, in a nutshell, those three basal ganglia cortical circuits. If you, for example, do transcranial magnetic stimulation, you can actually choose your target in the more motor circuits, such as the supplemental motor area, the premotor cortex. You can actually go for more cognitive parts of the circuits, like the dorsal lateral prefrontal cortex, or you can go all the way to the more emotional parts of the circuits, where you stimulate the orbital frontal cortex or the dorsal medial prefrontal cortex. So that already tells you that there's different circuits involved in OCD, and you could choose your target accordingly. Now we're working towards actually biotyping these different kinds of OCD, and we're trying to figure out if we can find a way away from the diagnostic classification using symptoms or ratings to see which part of their brains are most involved in their OCD in these three layers of these cortical basal ganglia circuits. And if that's something that's successful, we could then maybe tailor our TMS or our DBS towards those specific circuits.